So hello everyone, my name is Sarah Eisinga and I'm the Manager of Patient Programs, Research and Advocacy here at Lymphoma Canada. And today we are joined by Don, a patient from Manitoba, who is here to talk about his lymphoma diagnosis and life story. So you can start whenever you're ready, Don.
Good morning, Sarah, and thank you for the invite to everyone to let me give my little spiel about my walk with mantle cell lymphoma. Don Dunigan out of Clearwater Lake, Manitoba, northern Manitoba. I'm 65 now, and when I contacted the mantle cell lymphoma, it started fairly quickly when I turned 60 back in 2017. I was a regular at the gym, doing cardio quickies with people half my age. I was on my game at work. My bride, Vera, of 38 years, wanted me to retire from my cushy government job, but I was resisting. I wanted to keep working until I'm 65. Then in January of 2017, I noticed my stomach was starting to get bigger, and my lymph nodes around my neck and my groin were enlarging. And at first, I thought the enlarged lymph nodes around my groin was a hernia from playing too much hockey. Typical man thoughts, and I had nothing to worry about. But the growing continued. So my wife convinced me to go see my family doctor, who palpitated my stomach and said there was something there and further tests were required. And when she said that, we knew that there was a journey ahead of us. And on that bright note, we had a pre-planned trip to Barbados for a week, and which we took, which was a total waste of money because all we did was worry about the unknown. And I had no appetite, I had no energy, which is a lousy combination to take a holiday with. We returned back to Winnipeg, and we stayed in Winnipeg trying to get into the healthcare system. And that took about 3 weeks. I was getting steadily weaker and my symptoms were getting more pronounced. And I'd say that the biggest challenge we had in this dance with cancer was breaking into the healthcare system. We spent 3 days at in ERs waiting to be seen and admitted. My vital signs were fine. My heart rate was fine. My blood pressure was fine. So I got to sit with everybody in ERs, and the ERs were packed with people needing to see doctors. And, you know, cancer specialists are not sitting in ERs waiting to see people like me. So I was continuing to get weaker and weaker as time went on. At this point, it's critical to note how important it is for family to be involved with somebody who has cancer. My wife was my partner and love of my life, my lifeline, was very supportive for trying to get me through this and to get attention for me. I also had one of our daughters down with us, Darcy, and she was a pit bull in trying to get cancer specialists to come down to ER. And she was on the email trails, the smartphone, sending emails to Cancer Care Manitoba. And finally, a doctor actually came down to the ER, which was crowded with about 60 people, and yelled out, "Is there a Don Dunigan here?" And it was because of her persistence to get us in that we finally got somebody to take a look at me. And by that time, I was in bad shape. So I finally got in. My first night was in a broom closet, basically. I wasn't in cancer care yet. I was just admitted into hospital, but at least I was into the system. I had a lymph node excised off my neck. And after that analysis, a nurse came and said I had B-cell lymphoma and it was curable, and we'd be on that train to start that. So of course we were very happy. And the next day, a doctor came in to see me along with that nurse and some others, and told me I had, instead of B-cell, I had mantle cell and I would be in remission. So the poor lady, the nurse, was very apologetic, and not her fault. And it's, you know, the point of me bringing this up is that, you know, stuff happens along the way. and quick diagnosis, trying to get me in. It's important to get in, and I believe in the science. I believe in the healthcare system, and having that quick correction was very important to us, and it wasn't a big deal. So what I had said to the doctor at the time when I was told I had mantle cell was, sign me up and let's go. So a bed became available in cancer care, and I was admitted. I can't stress enough the quality care and attention I received while I was receiving treatment throughout the summer and fall of 2017. Excellent staff, nurses, doctors, custodians, everybody who was involved treated me with kid gloves, and I felt I was in the best of hands. I got some of that from, even though I was pumped full of drugs, I was also pumped full of information, and we received that information like a sponge. So on that point, I like to say that, information is power, information is control, and information helps to guide decisions, especially by people who are in the dance with cancer. By having that information fed to me, I felt like I had some sort of control and some sort of guidance over what my body was going through, and it gave me comfort, gave my family comfort. And another thing that we received was a binder that was chock full of information on the best practices from cancer expertise across North America. I saw information from British Columbia, Quebec, Ontario, the Mayo Clinic in the States. It gave us comfort knowing that professionals were talking, were sharing best practices, what was working, new information, and helping to combat this disease. It's also important that it was important for me anyways to reach out to others who had been on the same journey, even though with different types of cancers, but there are similarities in our needs and the support we needed. So I had a friend who went to the gym with me. His name was Lee, and he was a biker and a gym rat, and very blunt, of course, in how he talked, and he very much to the point. And he said to me one day, he came to visit me when I was sick, and he said, "Dunny," he says, "Dunny, if those doctors tell you to eat a bowl of crap, you eat that bowl of crap and you ask for a second, because those doctors, they know what they're talking about." And it was high praise coming from a guy like Lee, and it was true. It was, trust the science. Dr. Skrabic, around that, at the early stages, had come in to see me. Dr. Skrabic, being my cancer care doctor in Winnipeg, came in to see me. That they would, the process was they would bring me as close to death as possible, and then build me back up with a stem cell transplant. So I trusted her. I've trusted people that have been through the same walk. So I needed that trust to get us through it. So treatment took about a whole 10 months to get through, and it was a process of getting pumped full of drugs, being knocked down, super weak, recovering after 2 weeks, getting back on the horse, getting pumped full of drugs, being knocked down, recovering, etc., etc. Long flights home, no appetite, no energy. Made meal prep very easy for my wife during that time, because the only thing I liked to eat was egg salad sandwiches. I lost the taste for everything else. I'm a coffee addict and couldn't handle it. So my immune system was killed off by treatment, and a stem cell transplant was started, and I was up and running again. My kids like telling me I have a second birthday. When the stem cell transplant happened in late August of 2017 was my second birthday. So now the kids give me 2 birthdays a year. The first being my original when I was born, the second being when I was reborn with a stem cell transplant. These are my 8 grandkids. So a caricature of all of them. They are 11 years and under, and they're holding up their hands, and a big 5 is underneath. And the 5 is for the 5 years that I've been in remission. So it's been a nice journey so far. I'm still in remission. I liken it to surfing. I'm riding the wave, and riding that wave it's been fun. So we're trying to enjoy life as best we can. I've gained weight back. I think I lost close to 50 pounds during the process of going through cancer treatment. I didn't lose my sense of humor, nor did my family. When I was really weak and quite skinny, my wife looked at me one day when I got out of bed and I had no pajamas on, and she says, "Honey," she says, "you've lost your butt. Your butt looks like an accordion with all the flaps on it." So it's nice to be married and have a sense of humor and somebody in your corner. So right now we're living the dream. I have grandkids born since I've had treatment, so I've had the benefit and the pleasure of seeing them starting to grow. Couldn't have had that without having treatment. I run my own arborist business. I got out of government. I went back to work for 2 days after being out for about a year. I lasted 2 days, and I called my boss saying, "Can't do this anymore. It's not a pleasure anymore. I have to find things that give me pleasure." So I climb trees and I take down trees for people, and it's a lot of fun. They like seeing you show up. Not like being a government civil servant. That's a dig to my friends who are still in it. I'm still very much a firm believer in science and the knowledge behind the cancer treatments. I know I wouldn't be alive without them. Don't ask me what the drugs were and what got pumped into me. That wasn't from, I was just the recipient of it. There are professionals who know what they're doing, and they've been doing it well for me and for others. I want to say thank you to everybody who was involved with getting me my treatment, starting with my family. Couldn't have done it without them. The healthcare professionals at Cancer Care Manitoba, Dr. Skrabic. Thank you all for the journey, and hope this continues. See you all maybe in another 5 years. Take care. Bye-bye.
Thank you very much, Don, for sharing your experience with our lymphoma community. We greatly appreciate your words of courage and hope for those watching today. So thank you for joining.